So it's very
And
interesting.
I mean, the doing the preparation thing, that made me just sort of like think about that there can be situations, and often situations that arise in the therapy that like sort of like seemingly come out of left field, and and might sort of like throw us out of that I'm prepared, I'm grounded, position. So, for example, things like if the client becomes sort of like really angry and it's directed towards the therapist, not sort of like anger about what's happened to them, but anger around something that the therapist has done or not done or has brought up for them. Or also sexualized behavior towards the therapist that again seems to arise out of nowhere, and you haven't kind of been prepared or grounded for that particular thing to arise. And so I think one of the things that I'm curious to get your thoughts around is how can we balance responding to the client in a way that is not shaming, for the behavior, whether it's anger, whether it's sexualized behavior, or potentially triggering feelings of abandonment and rejection, while also managing whatever feelings that might arise in us, and to be able to set sort of like safe and appropriate boundaries.
Well, so I'm very happy to get to all that stuff. Just the point I want to make before then, and this will also relate, we'll be using something called the Regain procedure later on. We'll talk about it some, but we'll be training it in the workshop, is to recognize the fact that probably anything your clients does is probably triggering to you. But we don't really look at it that way. So we're sort of like Bambi's wandering around in the fields, da 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 da, and then King Kong hops out of the mountain and steps on us or something. Rather a morbid example. I don't know where I got that from. But the reality is that if we can be prepared for our own reactions, and that's the mindfulness lens that we look through here, which is what the client does is obviously very concerning, but our immediate job is to identify when we're being triggered, which I would submit to you, we're being triggered 50 times a session, something like that. If you say triggering, it's just when you encounter something that reminds you of the past and you relive part of that past to the extent that it interferes with your appreciation and responses in the present. We're doing that all the time. I mean, like, we're just living in a soup of subjectivity, right? We're not really looking at reality. We're responding to what we see. So I think part of what we'll be talking about here, and I think it's not hard to do, and I don't want to make it sound too technical, is we need to work to set our understanding of where our client's coming from and where we are from a position of relative mindfulness and groundedness, which if I didn't have that, I don't think I would be here. So that when someone does say something really outrageous, do something, there's just a quarter of a second between stimulus and response. They said, "You suck really bad. I hate you. I want a new therapist." And then your immediate response is, "Well, let's go find you one because I don't want to work with you anymore." But instead of doing something, you go, "Well, that's a perfectly logical, reasonable reaction, but it's not what I would like to do. What could I do differently?" But we have to be grounded and online before we can do that stuff. So uh, this workshop, which I've actually done in Cancun, I think I mentioned that to you, stretched out over 5 days, but it's the same workshop basically. A lot of it stresses sort of trying to empower the client to be less reactive to things, not by technique, but by understanding and by sitting in a position and perspective of enough knowledge that you can be compassionate. You can't be compassionate if you don't appreciate that the person in front of you is not doing something evil to try to get at you, but just to intervene in those ways. Now, for specific problems, and we can talk about that now, there are interventions you have, but we're going to be doing things like, I love this one, by the way, it's brand new. It's only the second time and the first time your folks would be experiencing it, something I call mindful co-awareness. This reflects the fact that when we teach people mindfulness, and Lord knows I'm one of those people, when we teach people mindfulness, we do it sort of in the old monastic tradition of what you need to do is pay attention to your internal experience and and just develop as a function of that and work with the material that's internally. But of course, as therapists, that's an open invitation of the blues, isn't it? You're going internal and your patient's throwing a cup of hot latte at you, right? So, how do you deal with those two things? So mindful co-awareness is, we will actually sit down in groups. It's not challenging. Don't worry about this, but we'll sit down in groups and we'll just interact with each other. And and we will try to maintain a sense of mindfulness, and then the person's going to say something or do something, or we're just going to look in each other's eyes, and it's going to activate something in us almost every single time. So our job, which is not training, we don't get this training in mindfulness. And in the work I do in mindfulness training, I'm trying to increase this curriculum more. But we need to be simultaneous. It sounds really mean, but that's the job we signed up for. We have to be simultaneously aware of our own experience and be aware of the experience of the client in a attuned, compassionate, caring way. That you see the trouble you get into if you retreat to a classic model of mindfulness. You're sitting there all grounded, your client's screaming at you, and you're going, oh, it doesn't help the client any. Or you're externally referenced and they go, I hate your guts, and you go, why? What's wrong with my guts? That's not working either, right? But we have to be as both things, going, I'm in this place. I hear something here. Oh, it's causing a reaction in me. I recognize that reaction is. I understand what's going on. It sounds like it would take a long time, but it doesn't take a long time. The brain works very quickly, and say, okay, given that I know that that's what's going to unfold now, what is the experience of the client now? What do they like? But the minute that we do that, because we're all empaths, right? The minute we try to be attuned to the client, we lose track of ourselves again. I mean, we do a little bit. And I've worked in trauma and emergency rooms for almost 40 years. We lose track. If we lose track in a fancy way, we just sound all like good therapists and we say fancy words, but we lost track, right? You know that feeling, you actually don't know what the hell you're doing, but you sound good, So, we lose. So it's actually a very lovely skill. And it turns out it's also helpful for partners and your dog. Well, your dog, not so much, because your dog doesn't need any help, but maybe your dog doesn't need any help. My dog needs a lot of help. I've tried mindful co-awareness with my dog. It doesn't work. But I guess that's not relevant.
That's not a good advertisement for them.
Don't do it with your dog. All right. So if you kind of get that, so we'll do something called regain, which is, there's an old Buddhist practice of rain, which some of you know, and it's recognition, acceptance, investigation, and sort of non-attachment or non-identification with whatever your mind is saying to you. So we'll actually practice that. We'll practice it step by step. Regain has been used only for the last couple of years, mostly since my 2019 book. I'm not plugging it. I'm just trying to make a point there of timing. And it was used for patients for our clients for a very long time. We've only been using it for therapists for about a year. But if you think about it, every time you're sitting there and your client says something and you say to yourself, what a friggin' borderline, what you're really doing is, that's a triggered response. And if you can regain that, you can stop from thinking that. It's not even just stop from thinking that, because that never works, right? You try to suppress stuff that pops up, but you can go, hello, clinical training. Hello, mom. Hello, being raised as a person of color in a white culture. Hello, just hello, whatever, and allows us to then move forward in a bit of equanimity. It also allows us to stay present. I think a lot of clinicians, I'm so sad this is true, but a lot of clinicians get burned out by their jobs, not because of the clients, but because of the environments in which we treat and work. And as we get more burned out, we shut down more. And the more we shut down with our clients, the less we have a chance to appreciate the vitality and excitement and connection of working with a living human being who's suffering, that we might be able to help them some. So ideally, you should be getting healthier and smarter and stronger the longer you're doing therapy. You should be more open. But should is probably the wrong word, but something you're meant to be, or some British thing like that. But but the notion here would be, can we use the psychotherapeutic process as a way for us to grow? I've worked in a burn unit for a bunch of years. When I went in there, I went, oh man, this is going to be the worst thing in my life. It turned out to be the most spiritually enriching time that I ever did in any context. So,
and I'm just going to,
you're going to try to bring me back to the topic. So what you're going to try to do?
But I really like what you're saying about sort of like being able to hold on to the the excitement, the spirituality, the meaning of the work that we do. And I think that people are going to be very excited and inspired by this training, John. So I'm so looking forward to hosting you again down under in Melbourne only, folks. So book and get your tickets to fly down to Melbourne if you're not in Victoria. And so thank you so much for giving us a preview, and look forward to seeing you in a few months.
Okay, very good. I'm looking forward to it.
Thanks, John. Bye.